She only has till 7:30 or she missed her flight, so. I'm
We're
sure
gonna-
you can relate to that.
So we're gonna try to move this.
All right, it's 7 o'clock. I'd like to call the Budget Review Committee to order. It's May 19th, 2022. The access is in person or via Zoom. The link is on the agenda. So we'll start by calling the roll.
Alderman at Large Laurie Wilshire.
I'm here.
Alderman John Sullivan.
Here.
Alderwoman at Large Shoshana Kelly's not present this time, but we do expect her hopefully shortly. Alderman Ernest Jettie. Absent. Alderman John Cathy.
Present.
Alderman at Large Michael O'Brien is present. And our chairman, Alderman Richard Dowd.
Present.
Mr. Chairman, you have a quorum. Also in attendance via Zoom, Bobby Bagley, Director of the Division of Public Health and Community Services, Kim Bernard, Chief Public Health Nurse, Heidi P. Kula, I'm sorry, Heidi, if I get the last name a little mixed, Manager Health Officer, and Robert Mack, Manager and Welfare Officer. And also who just joined us is Alderman Jettie.
Okay. Communications,
There are none.
unfinished business,
There is none.
new business resolutions,
There is none.
new business ordinances.
There is none.
And now I'm gonna ask for a motion to remove R22-035 from the table.
Mr. Chairman, I would like to make a motion to remove from the table R-22-035 relative to the adoption of fiscal year 2023 proposed budget for the City of Nashua General Enterprise, Special Revenue, and Grant Funds. And I think all members, except for
No
Alderwoman
business.
Kelly, so I think you could do it by voice
Yep,
vote,
voice
if you
vote.
so wish, sir.
So the motion is to remove the budget from the table, so we can talk about it this evening. All in favor signify by saying aye.
Aye.
Opposed, motion carries. All right, before we do that, I'd open it up to public comment. I see no one in the audience. Is there anyone on Zoom? Seeing no one, we'll go right into, tonight we're going to be reviewing public health and community services. So it'll be public health and community services, which is on, appropriations are on page 142, then community health appropriations on 146, environmental health appropriations on 149, and revenue on page 37. Welfare administration appropriations on 152, revenue on page 32, welfare assistance 153, and revenue on page 38. By the way, so that everybody that wasn't here earlier, Director Bagley is in the airport in New Orleans and only has till 7:30. So if you have questions for her, that's your time frame. Otherwise, she misses her flight. All right. So, Director Bagley, are you going to
Yes,
oversee all of them, or?
yes, thank you, Alderman Dowd.
Yep.
Bobby Bagley, Director for the Division of Public Health and Community Services. I want to thank you all for taking the time to hear our budget review. You will hear from all of the managers of each of the departments this evening as they talk about their budgets, and they will also cover the details of the revenue reports for each of their departments. As you know, the Public Health Department has worked very hard over the past couple of years to keep our community safe and continue to do so. We are starting to see a little bit of an uptick in cases of COVID. We've seen that for the past couple of months now, so we do anticipate that we will continue to see those cases. With that said, we're also seeing other things that we particularly pay attention to, which is an increase in other communicable diseases, our homeless population, mental health, and all of the other issues that we focus on with our businesses and food services. And so you'll hear from each of the managers as they will go through their budgets. I am starting on page 142, and I will go through the community services budget. I'll start first at the wages, salary and wages line, where you will see that there has been increase in there related to the cost of living, and the proposed budget amounts for fiscal year 23 based on those increases. You'll also see online, just going to go through the differences of the increases. Under property services, 54,100, electricity, you'll see that that has increased thanks to the renovations at our building, which makes us more energy efficient. We switched over to full electric, and so you'll see a significant increase in the budget from 22 to 23 to cover the cost of that switch over. You'll also see a decrease in the heating and oil line because we no longer need fuel, and so we don't have to cover the cost of that. 54,141 for water, according to the amounts for fiscal year 23, there is an expected increase in water, so I went ahead and increased that line. Saw in our actual line for 2022, you can see the difference between what was allocated for the initial budget in 2022, and that was not enough, and so that was increased to make sure that we could cover that cost. And under other services, under 55,118, under the telephone cellular, there's an increase in that line to cover the health promotion specialist and myself. We do have quite a bit of cell phone usage for remote work that is still being done on occasion. And so we want to make sure that we can cover that cost, so that'll cover the reimbursement for my cell phone as well as the health promotion specialist cell phone that has been added to that. Also have increased the dues and membership lines. We have a highly educated public health workforce. As a result of that, we have to maintain our credentialing. And so there are certifications that we need to maintain, so that cost has gone up to maintain those certifications and to also cover our memberships and our dues associated with those costs as well. And then also when we go and do presentations at conferences, that we also cover, you have to pay the membership fee for going to the conference, so that also covers that as well. And we've had quite a few of our abstracts accepted at national conferences, and so that covers that cost. What that allows for us to do, it puts Nashville on the map for the quality work that's being done over here in little old New England, in our state, but we get to be known nationally when we can present the work that we do. You'll also see an increase in the mileage line, 55,307. Because of the changes now, even though there are still things that are still done remotely for some of the commissions that I serve on and some of the other staff participate in, I do have to go to Concord to attend meetings in person in order for there to be a quorum. And so face-to-face meetings, attendance is required. I serve on a couple of commissions as appointed by the governor, as well as our state health improvement plan and our state health, community health assessment plan, which again require face-to-face meetings. Employee certification and training. Although we need to maintain our certification, we were able to just dip that down just by $100. The conferences, some of them are held online, some in person, but even when they are held online, there's still a charge. It's just been a little bit lower. Let's see. There's been a slight increase in other contracted services. This includes us paying for some of the outside technical assistance or training from other subject matter experts on topics that we have been increasing our staff development on, which includes topics related to diversity, equity, and inclusion to meet the criteria and the expectation of the public health staff to be able to perform our services using an equity lens. And so we do bring in outside facilitators to support us in that work. And so that's why you see a slight increase in that line. Let's see. And Our marketing and outreach line went down just a little bit, and that's because we've had an increase in the number of grants that help cover marketing and outreach. A big part of what we do in public health is around primary intervention and primary care services, which includes a great deal of education and dissemination of information through our billboards, through radio. We use social media, and so that has decreased a little because we have more money in the grants to help cover some of those costs. Miscellaneous supplies did have to increase that line by $500, and again, that's to help support the additional supplies that we will purchase to support the activities and the work that we're doing in the community that may not fall underneath a grant line. So for instance, some of the miscellaneous supplies included when they, one of the things that I used some of the miscellaneous funds was for acknowledging our staff for their good work over the pandemic period. And so I expect that we will continue to work that way, and I'd like to be able to continue to provide recognition to our staff for that work. So there's a little bit of an increase in there for that. Subscription stayed the same. The only other cost that looks like it went up here on this budget, our community health improvement plan. In the fall, we will start our community health assessment. This is something that we do on a 3-year cycle. And this costs us about this amount. When we did it 3 years ago, we tend to do a survey in the community, which is a little bit costlier, so we have increased this amount. This will also be supported by some of the funding that we get from the hospitals, because we do the community health assessment in conjunction with their community benefits that needs to be done. So the hospitals also contribute to this work as well. And then lastly, under 68,320, under the community health intervention of the CHENS, this has been increased by $10,000 to support the partnership that we have with the Youth Council. During the course of the year, they recognized that there was an increased need for services for the youth as a result of increased mental health issues and needing more counseling. And so we've increased that line by $10,000 to support that organization for our youth in the community. And those are the differences in the community services budget, which covers mostly myself along with our health promotion specialist, and covers hours of our epidemiologists. And all the other staff under community services is supported by the grants. Any questions?
Are there any questions for Director Bagley? Alderman Jettie?
Director Badley, under the second to the last item, it's 171, community services. There's a number in parentheses there, 27,905, I think it says.
I'm sorry, Alderman Jettie, which line number is it?
171.
Yes, 171 is the department.
Yeah,
It's
I think the specific
It's the
line
second.
item.
It's on page 143.
It's a bottom line cut. it looks like.
142, are you looking at 68,200 indirect cost allocations?
No, I'm looking at, on page 143, at the top of the page.
He's a page ahead, he's looking at the total.
Oh, community services,
Yeah.
Yeah, it says 171, community services, and there's a number in parentheses there, which
Oh,
I think
yes,
means a loss.
Alderman
but-
Jettie, that is the indirect that we receive from some of the grants. It's usually put into this budget.
So, I'm sorry, I didn't understand you.
So there's an indirect charge that we put against the grants, and that's what you see here, this negative 27,905.
Right, yeah. Is that, it's in parentheses. Does that mean it's a loss or?
Well, see, I'm not an accountant. I think that when I usually look at the parentheses, it means a negative. And sometimes that's interpreted very differently from from our finance manager, but that's an additional amount of money that's coming to the city, because that's the indirect charge that we, charge to the grants.
Yeah, it's monies
Okay.
that
So
aren't, we don't
May-
get costed.
can I follow up?
Sure.
So that's money that's coming into the city, so it reduces your budget by that amount, is that?
I believe so. You know what, how they use that in accounting, I would assume so, because the negative, usually when the parentheses is there, that's what that means. So I'm going to assume that that is correct. And I know that Janet's not here, to answer how they figure all that out with the indirect costs.
Okay, well, thank you.
But I
Any other
can get
questions?
that answer for you. And I will send an email out tomorrow through the clerk, through Donna Graham.
Thank you.
Any other questions, Alderman Sullivan?
Thank you, Mr. Chairman. Director Bagley, just one question on the, really the top line. I'm back on page 14, lines 171 through 175. There's a column in our budget books that shows total spent through, looks to be about 10 months. There's 2 months remaining in the fiscal year, and that's at about 1.9 million. If you're to annualize that out, that'd be about 2.2, 2.3 million. And yet the appropriation request for 2023 is 2.6. So the question I have is, the department ran, you know, if you were to forecast it out at about a 2.2, 2.3 million, and you're asking or requesting 2.6. Could you help me understand that
I
delta?
think I can answer that. We always have that issue with that number, because there are a lot of expenditures in the budget that happen towards the end of the year. Dues and subscriptions are one, conferences are another, and all of the expenditures happen after that number came out. So that's true on all the departments. And when they're going over their budget with the mayor and Mr. Griffin, they take that into account.
Okay,
So, because there are other expenses that happen between that date and July 1st that aren't shown.
understood. Do you think it'd be possible to have department heads forecast where they think their budget is gonna finish? I mean, if they have outstanding invoices and whatnot for the final 2 to 3 months, is that possible to forecast that? So at least we can have
I'll ask CFO Griffin if that's something they can do.
Okay,
Yes.
that was my own
And
question.
if I may, Alderman Dowd, so
Yes,
our
go ahead.
finance manager, Janet Graziano usually does do that forecast for us. So is the Alderman asking if that's something that they can see?
Yes, if I may.
Yeah, go ahead.
I'd like to get a better understanding, because right now I'm just looking at, through the end of April, the total spent by the department is 1.9 million. All I did was I took that number, divided it by 10, and then I multiplied it by 12, and I came out with 2.2, 2.3. So then I go all the way to the right, and I see an appropriation request for 2.6. So my question, when I looked at that, was you ran the department well below what you had asked for. So I was just curious as to why you were asking for 2.6 again.
So,
And Alderman Dowd, am I able to answer?
go ahead.
Yes, and so, yes, that would require for our finance manager to run those projections, and as Alderman Dowd said, between those, from what you see here in April up until June, there will be other costs that will be incurred, because some of the things don't get spent until the last May and June in our budgets.
Okay. Okay.
Some supplies aren't bought until May and June. And in fact, our health officer can speak to that. Some of the supplies that they buy, they don't buy them until late May, early June. Some of the health promotion and the educational things that we do. For instance, I'm in New Orleans this late in the year. A lot of our conferences aren't scheduled until late in the year, and so that's when we get to spend some of those dollars down, as well as some of the other costs incur. We've tried to spend down the dollars in the grants first, and then we use the money that's in the budget from the city budget. So that will also show where there's it will look like there's an increase in expenditure in our budgets in May and June from our departments.
Okay, thank you.
Also, divisions can't spend in the negative. So it's very difficult to exactly pinpoint the pennies. The monies that are left over in any of the budgets go into an account that will be used to offset taxes and other things that the mayor will explain when it gets to that point. So, for instance, in the school department budget, they can't, only once that I can remember, did they ever overspend, and that was a confusing time, but they can't overspend. If they were getting to the end of the year and they needed more money, they'd have to come back to the board and get a new appropriation. But that normally doesn't happen because they don't budget to the exact penny to try and finish the year.
Mm-hmm. Okay.
All right, thank you, Bob.
And Alderman Dow, just for
Alderman Cathy.
Alderman Jettie, for Alderman Jettie, he had the question about the 27,905. Alderman Jettie, if you look at under other expenses and you look at 68,200, it shows the indirect cost allocation, that 54,405. And then under there, the 6,500 for the community health improvement plan and the CHINs is deducted from that. And then you'll see that 27,905 is what's the difference of that indirect, those indirect dollars that are left over from the grants.
Okay, thank you.
All right. Alderman Cathy?
Thank you, Mr. Chair. I just have a few questions. How many positions were added specifically related to COVID? And are those positions still filled, and are they still needed? Because obviously the pandemic is not as heightened as it was 2 years ago or even last year. So I'd like to know if that's where you're at with the positions just related to COVID.
Director Bagley?
Yes. So is this a question about the positions that are under the grants or positions that are under the city? All of the positions under the city budget, all of those positions responded to the COVID pandemic. It was an all hands on deck approach. Some positions spent more time than others, but everybody at the division that's paid under the city budget responded to COVID. Now, even though it may look like the intensity of the pandemic is over, we are still doing a great deal of work as a result of the impact of COVID on people in the community. And you'll hear some of that from the other managers as they go through their budget. So all of the city employees are still responding to and doing work related to COVID. As far as additional staffing, Alderman, that staff is still there. That staff was paid for by funding that we got through the state, which is a pass-through through the Center for Disease Control, to continue to sustain the workforce that we currently have. So we have a total of 34 individuals at the division right now, and we have funding to maintain those 34 individuals.
I got two more.
Okay, because she does have a flight to catch, so.
I'm aware, I'm looking at the time. Real quickly, you mentioned the electricity improvements. Maybe this is a question for the finance person that you spoke of earlier, but do you anticipate or have any anticipation of how much that's gonna save you long-term, spending this money up front, and then would we be able to find out a projection of spending the money up front, how much you're gonna save on the electricity since you're making all these improvements?
So we haven't been in the building for a full year yet. We moved back into the building in June, which was over the summer. And this June will be our first full year, and so we probably won't be able to see the difference in the cost savings until next year. And then also Doria Brown, who is our energy director, will probably be able to help us understand what has been the savings, but we haven't been for a full year yet to be able to do any assessment on how much efficiency or what we're saving. The building right now is the most efficient that it's ever been because of the upgrades in our HVAC and switching over to electricity opposed to paying for the fuel.
Okay, thank you. Last question. I noticed looking through the salaries and wages, and this department is not the only department that I've noticed this, but there's a 6% increase in your salary alone, and that's happened in a couple different departments. I'm wondering how your salary is determined, because I'm thinking not a lot of citizens are going to get a 6% increase in their pay in an inflationary year. It would be hard to justify that sort of an increase, and so I'm wondering how that increase is determined.
We have it's a 6.09% increase across everyone that's at the city. We all got the same increase, not just my salary, but everyone in the city got the same. It's a cost of living included with the 4% increase that everyone has gotten across the entire city. So my salary is no different than anyone else's, and all of our salaries at the division as well as across the city, we all got that same increase.
So that'll be across the board. You want to ask Director Griffin, CFO Griffin.
I'm good with her. I can talk to you later.
Nobody else has anything, we'll let Director Bagley go. All right, thank you very much.
Travel safe.
All right.
Have a good flight.
Yep.
Yeah, have a good
All
flight.
right. Thank you.
Okay.
You're left in good hands with the managers, with our health officer, our chief public health nurse, and with our welfare officer. Have a good night.
Okay, thank you.
Mr. Chair, Mr. Chair, may I ask a quick question? Is that an unaffiliated contract
Yes.
increase?
Yes.
Okay, all right.
Yeah. And those numbers were set by the Board of Aldermen.
Right.
Alderman O'Brien?
Yeah, and just to let you know, as a former deputy fire chief, I was in the unaffiliated. There's been years these people didn't get a raise, because I can testify and show you
You weren't part of the union?
no, not as
Not as a
management, because I was a chief officer. So I'm happy to show you pay stubs, because I saved them, of years I didn't get a raise.
You didn't frame them?
You're that
No,
guy.
you don't live 25 years under a spending cap without any ouch, you know?
Okay, the next department is 172, Community Health. Who's up on Community Health?
Kim, you're on mute.
You,
Yeah.
Can
Kim?
you hear me?
Mm-hmm.
Now we can.
Okay, good. Sorry about that. You'd think I'd figure this out by now. So, good evening. I want to thank the board for allowing me to speak to the budget this evening. My name is Kim Bernard. I'm the Chief Public Health Nurse for the City of Nashua Community Health Department, and I'm also the manager for the Community Health Department. I'm going to go through and talk about the changes to our budget for this budget year coming up, 23. Under salaries and wages, we currently have 5 FTEs under the city budget and 3 that are fully grant funded. The increase is based upon the 5 FTEs under city funding. This increase is based upon the unaffiliated wage and salary grid. Under property services, we've had a slight increase under disposal services for biohazard disposal. This supports partial payment in conjunction with grant funding that we also receive. Security services, again, slight increase, and this is for our alarm system for our vaccine storage unit. And it's reflecting of a change in pricing with updates to security after our renovation. Vehicle repairs and maintenance. This line has decreased about $1,500, and this is due to the fact that we did complete some planned upgrades to our outreach van during the FY22 fiscal year, FY22 period with city and grant funding. So we've decreased that line for the upcoming year. Under other services, dues and memberships, we have a slight increase for staff to belong to professional organizations. Conferences and seminars, we have increased this line, and that is to fund professional development for staff and for partial funding for a conference for our local partners surrounding public health topics. This is something that we do every year. The past few years, we have not been able to hold these conferences, and that's reflected in the FY22 budget. So that's why you'll see that larger increase there. And postage and delivery, a slight decrease there. We have a new electronic medical record, thankfully, that we rolled out in the fall, and we're able to utilize technology through this EMR system to contact our clients. Under supplies and materials, the decrease under educational supplies. This funding here in the city grant supplements grant funding, and the amount that we have would be appropriate for what our needs are for the upcoming year. Under miscellaneous supplies, a slight increase here. In that line, we use items, as Director Bagley had mentioned, for items that just fall under other funding lines or grants, and for things such as supplies or snacks or water for clients during outreach or events that we hold in the community. And those are all the changes to our budget. And if you have any questions, I'd be happy to answer them.
Does anyone have any questions? Alderman Sullivan.
Thank you, Mr. Chairman. Under salaries and wages, you have an overtime line,
Yeah.
and it's quite low. I was just curious, why it was so low? You have proposed $5,000, and through April, you've used $531.
And your question is what? I'm sorry?
I was just curious as to why it was so low, why there was no overtime or whatnot used.
Most of our staff is salary, so we don't need a lot of overtime hours.
Okay.
Anything else? Alderman
No,
Sullivan?
that's it.
Anyone else?
Well,
Alderman O'Brien.
yeah, thank you. To follow up on Alderman Sullivan's question, and it's a good one, but compared to other years when you've done the budget, last year we were under the COVID. That did have an impact on some of the overtime because some of the things were done virtually into office and not so much out there in the streets exposures that you have done in the past. Would that be a fair summation on why some of that numbers could have been lower as well?
We did not get overtime for that work.
Okay.
It's probably unusual circumstances.
Yeah.
Alderman Sullivan?
Thank you. Just a general question for folks in this department. I know that some city employees count on overtime. Sometimes they, use it as part of to help their income. Is that the case in this department? I mean, do they, you have 5,000 set aside, and do they count on that as part of their yearly income?
I don't think so. There's
Well, if I could answer as a firefighter, I used to get called in either the pilot or something if a fireman was injured, at a fire, we had to backfill that position. That would be overtime. Nobody really goes out there and does a illness or sick dance or accident dance, God forbid. And I don't think Public Works really does snow dances praying for a blizzard, you know what I mean? So these things just naturally kind of pop up. But like in the case of like the state of New Hampshire just realized, just so you know, recently that Public Works employees are now classified in this state as first responders, because where they do come in these type of emergencies, and like everybody else, I mean, I hate to say it, but a lot of our city employees are family type of people. They have children. Some of them may not have the best teeth, they need an orthodontist, and so, little fairies don't mind, drive the plow truck, so, they do need to be compensated for some of these things, but I would be, nobody really relies on the, per se, on the overtime, you know what I mean? It's nice, my father brought me up to say, never refuse it,
Right.
but I don't think anybody does a blizzard dance or anything else.
The majority of overtime spent is by salaried union employees that have it in their contract.
Right.
Right.
In this case, since there's nothing appropriated or requested for fiscal year 2023, is it better to have it and not need it than need it and not have it? And I'm not saying that she should put in $5,000, but I'm saying maybe there should be 1,500. I don't know. I'm just throwing that out there.
Again,
She may know her department better, but
I would suggest that you ask Mr. Griffin on that as well. You'll find sometimes that we have line items that are zero funded or not funded, and it's difficult to remove a line item in the budget.
Right.
And he can explain that to you. I'm not gonna try and explain it to you, but it's easier to leave it in, and
Yeah, and-
Alderman O'Brien.
yeah, Alderman Dowd, I do have a question, perhaps maybe to help out others. They come, every single department will come before us with their particular budget. The first thing is, the key is, the mayor sets the tone, basically, for the city. And the question number one should be, you're under what the mayor recommended for your, particular division. Then looking at that, at the end of the fiscal year, it's the city of Nashua. We're not a business. The place was never intended to be run like a business. We're supposed to be providing services to the community, and that's where the tax dollars basically go. So the money at the end of the fiscal year goes back into the general account. So, if it is appropriated and it doesn't get used, it will go back into the general account come July 1st.
There's, you'll have a whole series of unlikes and appropriations that the mayor will make relative to reducing the tax rate and other things. But that's after the budget's, once the budget's closed by sometime in August, September, that's when you'll see the monies that weren't spent for this year will be reallocated somehow.
okay.
All right. I think we're all set unless somebody else has another question. Thanks, Kim.
Thank you.
All right. Next up is environmental health. Heidi?
Good evening. Sorry, I'm talking over you. I also have an obnoxious cat who wants to get some attention. So just bear with
Good
me.
luck, Heidi, then.
Yeah. Heidi Pikakoka, Nashua's health officer. Thank you for allowing us to present on our budgets. I'm actually going to go through our revenues briefly, if you don't mind.
Sure. The revenues are on
Let's see.
page 37.
Yes. Our pools expired at the end of April. We just started collecting those license fees. Our food service licenses are probably going to be close to our target amount. It's been a very interesting year during and post-COVID. Well, we're not post-COVID, but things still continue to affect food service, but we see an awful lot of change of ownerships. Solid waste licenses expire at the end of June. We've just had a new one come in. That's about it. Our septic fees are higher than normal, and that just indicates a lot of activity in that market. Let's see, and we have not been issuing tickets recently. We've been working with food service establishments to get them back on their feet. And we will start doing that. We hadn't collected reinspection fees for a while. after the reopening of food service. And miscellaneous fee, that's for copies pretty much, and we, everybody wants information electronically.
Okay,
So, go ahead.
any questions on revenue, Alderman Jettie?
Yeah, I noticed that, your fees, when I looked at the ordinance establishing your fees, like for inspections and stuff, the last time that that was amended was in 2006. So it's been, what, 16 years? Isn't it time to reassess that? And isn't it time for, I mean, when you talk about, helping restaurants get back on their feet and not issuing, permit fees or fines or whatever, the thing that comes to my mind, and I don't want to offend anyone, but what authority do you have to do that? I mean, if the ordinance says they're supposed to pay a certain amount, and if they violate the ordinance, if they're not, protecting the public, and they're supposed to get a fine, I'll be honest with you, it bothers me that that your department would, just decide that people don't need to pay those fees. I think that if that's appropriate, and I don't think it is, I think these people are in business to to make money, to support their families. I understand, to support their employees. I understand that, but it's a cost of doing business. And the other way of looking at it is that we, the city, in order to protect the public, we're inspecting these places. We're, teaching them, what temperature they should have their refrigerators at, what temperature they should be cooking the food to, and all this stuff. We are assisting them to, protect the public and to help these people make money. And it's only, I think, appropriate that that you should charge and ask the alderman to amend the fees so that we're charging, what it costs to do this service. So that's a long way of asking you. Are you looking at, your fee schedule and making recommendations to us to bring that up to what the standard should be today?
Mr. Chair, shall I go ahead and
Yes,
answer?
go ahead.
I think you said yes.
Yes.
Okay, thank you. Yes, we have a couple of models that we're looking at to update the fee structure, and we want to get away actually from the specific old-fashioned way of describing the individual facilities. And so it will be a lot more current, and so we've got a couple of things, and we do want to bring that before the Board of Aldermen soon. Was there another part to that question?
Alderman Jettie?
I'm satisfied to hear that you're looking at revising the fee schedule, and you're gonna be coming to us and asking us to update that. That's good enough, thank you.
Also, in fairness to Heidi, she works with Director Bagley, and Director Bagley has guidance from the mayor, so just throw that out. Alderman Kathy?
Thank you, Mr. Chair. Being new to this department, the 1,033 inspections, is that all new inspections or the yearly inspections, or are you going to some businesses multiple times? Like, how often do you have to inspect, or can you inspect every month if you wanted to? Just not clear on that process.
Okay, I'm not sure what number you were referring to as far as inspections. Oh, that's in the packet that we
Yeah,
put together.
sorry about that.
Okay. All right, yeah, because I'm looking strictly at these numbers. There is a little bit of variation. Pools and spas are ideally checked twice a year. If we have an opportunity, we will do an extra run through of the indoor pools and spas around Thanksgiving time. Food service is typically oh, sorry, cat.
Was that the cat?
Yes, it is, because I should be paying attention to him. Okay, food service. Anywhere from 2 to 4 times a year. There's a mandatory requirement for 2 times a year, which is sometimes difficult when it's a strictly seasonal type of operation. And FDA recommends 4 times a year for more complex places or places that serve a more vulnerable population.
Okay, thank you.
All right. Any other questions?
Thank you.
Alderman O'Brien.
Thank you. And to follow with the overtime and everything too, Heidi, you know, like we have worked together on many different calls. This is one of our divisions, such as if the fire department has a situation, there's been many. I remember one snowy night, tractor trailer truck caught fire on the highway and he was delivering chocolate, full of chocolate. Candy bars. Well, you can't let that go because the chocolate with the smoke and the fire has been contaminated. And unfortunately, it turned out, do you remember that incident, Heidi? It turned into be Nashua's problem. What a sweet deal. But it couldn't be sold. And so this particular division comes out in the wee hours with the fire department as required by state law to recertify a business that they clean up and meet the code standards and everything. So very appreciative of what you do, Heidi, in your division. Thank you.
Thank you.
Yes, Alderman Wiltshire.
Thank you. Heidi, I appreciate your work, your staff. I mean, I know they come to my business where I work and they do food service inspections and they're thorough, and they're fair. You know, if we have something that's not marked, they'll write us up for something that's not marked, but it should be marked. So, yeah, I find them very fair and easy to work with, and I want to thank you for that.
That means a lot. Thank you.
You bet.
I will relay that to our staff. Thank you.
And I've worked directly with Heidi on some restaurant stuff, and she's very thorough. And also, they also inspect our schools, all our school cafeterias, who, thank God, get very high marks. Any other questions for Heidi? None? Thank you.
Do you want me to go through the?
Yeah, we gotta go through your spending.
I'll be brief. I'll just give you the highlights on significant changes. You'll see under consulting services that we've gone from $6,000 to $7,000, and for our newer aldermen, oh, damn it. Hold on just a second, please. He's biting me. I was afraid of this. Anyway, that is for mosquito surveillance. We hire with Dragon Mosquito, and from approximately the 1st of July and up until mid-October, they conduct mosquito surveillance for us. Trapping, identification of mosquitoes, and submission to the state lab, so that we have, that's our best way of knowing that we have West Nile virus in our community. And knock wood, we have not had EE in Nashua that we know of. So that is probably one of the biggest changes. Under other services, 5500 communications data. That was data to support our tablets in the field with the Civic Gov software. That has not worked out really well for us. We need a more specific program for the inspections. And so we're going to cease that this upcoming budget. Memberships, dues and memberships have gone up $100. We're trying for some National Environmental Health Association specific credentials, and we get a cost break on some of the trainings that they offer if we're all members. So everyone but our office manager is now a member of NEHA. And then we dropped the employee certifications, training and certifications down by $200. And you'll see that that has not been expended. A lot of our recent trainings have been free of charge and virtual. FDA has just put on some really good ones recently that have been very beneficial to our staff. And then we boosted our laboratory supplies because reagents have gone up for pool testing. Pool sampling analysis. And then miscellaneous supplies, that pays for, say, the paper that the licenses are printed on, if we need more for educational supplies. And that's really about it. Those are the highlights.
Questions? Seeing none. Thank you, Heidi.
Thank you.
Next is the Welfare Administration. Before that, I have a text message from John Griffin. He said, for the unaffiliated salaries, that the next meeting with Kim Kleiner, we should ask her because that's in her bailiwick.
Okay.
Okay, so welfare, that would be Bob Mack.
Yes, good evening. My name is Bob Mack. I'm the welfare officer for the city of Nashua. Thank you for the opportunity to present tonight. I will be presenting on 174, the welfare administration budget, as well as 175, the welfare general assistance budget. As you can see from the welfare administration budget, basically the primary expense that we have is with our staff, and it's kind of similar with all the departments. The departments within our division, our staff are our greatest assets. And in the welfare department, you'll see, as noted, the salary increases are in accordance with the fiscal year 23 salary grid. Our staff, we're made up of 6 full-time staff in the department, including myself. We have 3 case technicians, a senior case technician, and an intake worker. And as I mentioned, they're our greatest asset. They have various experience working with social service agencies, coming from social service organizations, with case management, with customer service, bilingual, bicultural experience, and the like. So that is, again, our greatest asset in the department. We have some general expenses. There aren't really any significant changes in our other services. We had one slight increase in training and certification of $100. So you'll see a very minor adjustment in that line. And that is about it for the welfare administration. I don't know if there are any questions.
Questions? Alderman Sullivan.
Thank you very much. First, a comment, Mr. Mack. We had a homeless encampment in Ward 9 back in the woods, and your team helped us alleviate that situation, so I wanted to say thank you. Hopefully you can speak to this, but I jumped back to revenues under welfare, and I had a question, welfare administration.
Yep.
Can you explain welfare recoveries?
Certainly. If I may, Mr. Chair?
Yes, go ahead.
So the welfare recoveries are basically, we're lucky if we get anything. In accordance with the statute, if a client that is eligible for and receives assistance it returns to income status and is able to meet their basic needs and can repay the city, they are expected to do that. As you can see, I think our recoveries was identified at like $12,000. We've collected $1,000 in revenues. We occasionally get personal reimbursements from the clients that we assist. One of the other aspects of recoveries would be if a person owns any real property or assets, we are required by law to place a lien against those assets. And if there's any activity that takes place with, say, a piece of property, home is sold or refinanced, we may get reimbursement through any sort of lien placed against that property. Those are the basic ways that we collect any revenues or recoveries. So we don't count on it very much, but again, whatever we get, we consider it kind of a bonus. I hope that answers your question.
It does, thank you.
Okay, any other questions? Alderman Kathy?
Thank you, Mr. Chair. Under the welfare assistance, the first line, assistance for shelters, I see that right now, through 10 months, you've only spent $200,000, but for this upcoming year, asking for an additional $150,000. I'm just wondering why it went up that much when you didn't even get close to the $400,000 from the previous year.
Okay, Mr. Chair?
Yes.
So as far as the general assistance budget, you do see what was appropriated for this current fiscal year, what our expenditures are, and what our proposed budget is for the upcoming fiscal year. A lot of the expenses that we predicted, it's been an interesting couple of years for everybody. And what has come through this COVID situation is there was a lot of funding that was injected into the economy. A lot of funding came down from the federal government through the states. And one of the primary areas of assistance was around rental assistance. So a lot of money came to the states for rental assistance. And when I mentioned the staff earlier, I think a lot of the time that they spend, that they would have spent historically providing direct assistance to help somebody pay their rent, they were spending that time identifying need and identifying other resources that they may be able to be referred to get that assistance instead of getting it direct from the state. So a lot of the funding that we did not need to spend was because of those programs that currently exist in the community. Now, those programs are time limited. One of those main programs is overseen and managed by the New Hampshire Housing Finance Authority and administered through the community action programs or CAP agencies such as Southern New Hampshire Services here in Nashua. And they will provide rental assistance for a rather extensive period of time for those that qualify that have COVID-related hardships. So that's why we saw a pretty significant decrease in our need to spend that line in particular for this current fiscal year. With that in mind, we're not sure how much longer those programs are going to last. They were funded pretty significantly, but they've also spent a significant amount of money assisting a number of clients. And it's not just for Nashua, but it's for the entire county and state, if you will. So being conservative, so we don't run out of money, because welfare, as Chairman Dowd had indicated, it's not good to go over budget. Welfare is one of those departments, it's a state mandate according to RSA 165. We can't just say we don't have the money, so we cannot assist you. If people are determined eligible, then they must be provided the assistance they're eligible for. I don't want to get too much into the history of it, but 20 years ago when I started with the city, there was a $650,000 general assistance budget. I started in January and they had already spent close to $1 million on that general assistance budget because they could not say no to the people that were applying for and eligible for that assistance. So to avoid that, we try to budget accordingly and make sure that we have sufficient funds to cover payments for those that are eligible. I don't know if that answered your question.
It does. Can I get a follow-up, Mr. Chair?
Sure.
This is more of a curiosity. I noticed on the medical line, that line went down significantly. Can you speak to that?
Yes, if I may, Mr. Chair?
Yes, go ahead.
The medical line is primarily prescription assistance. Most folks, we are able to direct to apply for different insurance programs that are offered through the state. If people don't get it through their employment, if they're unemployed, if they're receiving state benefits, there are a number of different insurance programs offered through the state. So as I mentioned before, the staff spend a great deal of time assessing need and directing people to those resources so that they don't need our general assistance. Now, there are occasions where people experience a gap in that insurance coverage, and we may have to work with them to assist temporarily with the cost of a prescription, so that they don't go without the medication that they may need. So you'll see it's a rather low expenditure. Years ago, we had spent significant amounts of money. We had spent $80,000-$90,000 a year when people didn't have these insurance programs. So that again is a focus of getting people connected to some of the insurance programs that now exist.
Thank you.
Is that, any other questions about Alderman Wiltshire?
Mr. Mack, have you been with the city 20 years?
Yes, it has been 20 years.
I remember
Wonderful years.
when this budget was $1.5 million.
Yep.
And,
Yep.
and since you've been at the helm, I think you've done a really good job at managing the budget, at referring people to other resources, at staying on top of other resources, and kudos to you.
Thank you very
Well,
much.
thank you. And if I may respond,
Yes.
Mr. Chair, I do appreciate that, Alderman Wiltshire, and you've been very supportive of us. And again, I go back to what we were able to do initially, and when we were spending a lot of money, we had to bring on staff to spend more time with these clients, assess need, and also identify those alternative resources. We have some great community partners out in the community, a lot of the nonprofit organizations, the hospitals, medical providers, what have you, shelter programs, food banks, food pantries, fuel assistance programs, etc. So if not for those partnerships and the efforts that our staff make to develop those partnerships and gain knowledge about those programs to connect people to those resources, we could have a much different situation and circumstance. So again, thank you very much for the comment.
Any other questions for Mr. Mack? So you've also covered welfare assistance, so thank you very much. Yep, all right, so with that, I'll entertain a motion to table R22-035.
Mr. Chairman, may I make a motion to table R22-035?
Motion on the floor is to table the budget R22-035 till the next budget meeting. All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Yes, I know. Okay, and now we'll have public comment. Is there anyone in the chamber or on Zoom?
Hi, yes, good evening, Lori Ortolano, 41 Berkeley Street. I know the next meeting, I don't know if it's Monday or Tuesday, I didn't check the calendar, but there's a lot of budgets coming in for that meeting under Administrative Services Director. And I want to share with you my concerns a little bit and hope that there are some questions asked about the right to know paralegal. You know, that right to know coordinator position when it was hired in December of 2020 was pretty distressing to me. I didn't want to see that come in because I felt that that position would present hurdles and obstacles to the public getting information as we wanted it. And it did. It resulted in 4 lawsuits over an 8-month period. One was the sanctions that were one other citizen, 1 a right to know, and 2 pro ses put in by me. The final judgment isn't in, but the city did acknowledge that there was wrongdoing there in court. So that presented 4 legal actions, and I wasn't a fan of that. Now I see this right-to-know paralegal coming in. There was no job description. Some of you might have seen, I think I tried to put it out to the budget committee that I've asked for the job description for that. But when I look up what a paralegal does, I don't think it belongs under Administrative Services Director. And I'm very concerned by the tracking that continues to go on for me. These are the Assess Help emails that were sent to me from my last lawsuit that were only sent to me 2 days before the trial, which was records I was supposed to receive a year earlier. And this is one of 3 batches of records the city had that they didn't provide me. Now, these were all emails sent to Assess Help for help. I had 9 emails I sent in. I was trying to find mine. I didn't know what other people sent in, but I have 9 pages of this, or all 3 batches. Look at all of these in here. This is one abatement, the way they're clipped. So clearly, citizens were sending in a lot of information to that line because the assessing office was closed. And when I see my questions pulled out and shipped up to Ms. Kleiner and then sent to a chief who has to respond to them, frankly, it just infuriates me. And I hear the mayor say, you know, Chief Vincent left because he had to deal with Lori's right-to-knows. My questions were sent into Assess Help, and I call them right-to-knows because they were just questions. They weren't acknowledged as 91A
30
issues,
seconds.
91A issues at all. They were just questions just like these citizens and what they sent in. But mine got pulled out and flagged. Now, Chief Vincent always said he was going to be here a year. I was aware of that. He stayed 14 months. I'm not certain I want to play the blame game on what citizens did, but I'm really opposed to what I see going on with positions and that position in there. It'll be another battle, and I don't want to go through it. Thank you.
Okay, I see no other public comments, so general discussion. None?
Oh,
Oh.
sorry. Could we, just, I saw a lot of emails going around, and just wanted to finalize the budget meetings that we have, next week, meetings like this. It's my understanding that we have one on, is there one on Monday, or is that just a special budget meeting?
The one on Monday is just a regular budget meeting, and the
Okay.
agenda was too large to include administrative services with that agenda,
Okay,
or we'd have been here sleeping overnight.
yep,
So, the administrative services got moved, and I don't have the.
I think it's Wednesday, it's the 25th.
Yeah, I think you're right, yes, because it was, I think it was gonna be an infrastructure meeting, they got canceled, and we took the date. There aren't a
Okay.
lot of open dates, but.
Right, okay.
Mr. Chairman?
Yes,
Yeah, I know on infrastructure, you owe me the favor. I did give you an extra date and delayed an infrastructure meeting so we could get this done. But I think maybe if we, in the past, I do remember trying to come up with a master sheet, and I know sometimes it's hard to completely follow. I haven't seen that this year yet.
Yeah.
But there is, they come out? Okay, so you did get that, Alderman?
I did,
Okay, good.
I just wanted to, because I know we moved some dates around, and I just wanted to make sure I had it tight.
Yeah.
so,
It's just, I found it convenient because then you can do your homework and get ready for each individual
Yep.
division. Thank you, okay, good,
Yep.
good.
so any other general discussion? Seeing none, remarks by Alderman? Alderman Kathy.
Yeah, I just wanted to thank the department directors for coming in and speaking to their budgets and answering our questions. Thanks.
Okay, anyone else? If not, Alderman O'Brien, I need a motion.
Yes, Mr. Chairman, I would like to make a motion to adjourn.
The motion is to adjourn, all in favor signify by saying aye.
Aye.
Opposed? Motion carries, we're adjourned at 8:09 PM.